you very much. I have questions, a lot. Maybe we can, if we can be connected with Tom for the live injection. Oh. Okay. Good morning. Hi.
Good morning.
Good morning, Tom.
How are you?
Hi. I'm doing great. How about you? So we had a great lecture from Jonathan Sykes.
Yeah.
Regarding the anatomy, the upper and lower eyelid, his technique and everything. And now all of us were looking forward to see your technique about the eyelid, the tear trough injection.
Yeah, tear trough is a very interesting part of the face, and as some people pointed out yesterday, the actual tear trough almost never gets injected in my hands. What I want to show you is the importance of assessment and the importance of distinguishing the fact that when we age, we have a skin that grows, we have volume that diminishes, and we have the strength of the skin that will change as we age. This is Vecna. Vecna has had blepharoplasty upper and lower 3 years ago, so the skin excess has been taken care of. But what she's left with is skin differences in thickness and strength and volume loss. So we're going to address that with hyaluronic acid. First I'm going to draw. I never draw, but just to show what I'm going to address. So bear with me. You see that this skin is thick, this skin is thinner, and this is even thinner. So if you want to rejuvenate this area, I think it's important not only to volumize, but especially here, make the skin a little bit stronger to compensate for what age has done. So if you want to know where the vulnerability is, where the strength has been lost, you simply squeeze and the skin will tell you this, that. This is where we lose strength. And the last of these linear dermal weaknesses is where the zygoma is attached with McGregor's patch. So this is what we need to strengthen in order to make the smooth transition from the cheek to the lower eyelid. Now I need my assistant, beautiful Nikki, to help me with the second part of the, can I have a white shot? The second part of the assessments, just to point out that it's vital to not watch your patient, but actually can feel where the volume loss is. And this is so much more accurate than watching. So normally I would look out the window. We don't have a window here, so I'm blindfolded. With volume here. I feel the orbital rim not being cushioned by any fat tissue here. I suspect somewhere on the zygoma here there's volume loss. So try this on your own eye, and you will find that feeling is so much more accurate than looking at the shades. So we're going to take one hyaluronic acid and use it for both layers. So as I said, the drawing is just for show. You actually can see where the skin wants to be strengthened. If you want to strengthen the skin, you use your hyaluronic acid in the dermis. This is where the dermis is. can see with every stroke there's a change in that pattern of weakness. So this is what I call the Palma technique, which resembles the fern pattern technique except for the fact that it's just one-sided. You see that the strength here is making this second line more apparent. So the Palma technique is a combination of half a fern and a stem underneath, which is the volume needed to complete the non-surgical rejuvenation of the infraorbital area. And given the fact that when I had this surgery 3 years ago, we're not bothered with a surplus of skin anymore, so we can enjoy the two virtues of this hyaluronic acid. Intradermal for strength, and subdermal for volume.
Tom, can you tell us please about the product that you chose to do this technique?
This is a high G prime Nasha, and it's one of the oldest hyaluronic acids, so it's a gold standard in the industry. And some people might find it old-fashioned, but it's old-fashioned like a brick. We still use bricks, right? The safety profile is excellent. What I need is a hyaluronic acid that's really strong, that really will stick where I put it. And this is almost crumbly. You can see if you put it under skin, you play with it. It's like Hamasundaram said, it's almost like couscous or rice. So the most inferior weakness, linear-dermal weakness we're addressing on this side is where there's like a metacutaneous ligament or McGregor's patches attached to the zygoma and the skin. So every time you squeeze the skin, it will reveal its weakness. Once you strengthen that, you can see a shortening of that particular line. So I don't think any non-surgical rejuvenation of the under eyelid is complete if you don't address the skin. And actually, looking at the very thin skin here, sometimes something might appear as being deep, but it just looks deep because the skin is so transparent, and you see the muscle underneath, which is the color of beefsteak, and you see veins and all that, giving the appearance that it's deeper than it actually is. And this dermal strengthening, you can take it all the way up. This.
Tom, I have a question from the audience.
Yep.
I mean, how much is the quantity of the product that you have used so far? I mean, the volume?
0.1.
Sorry?
0.1.
Okay.
So, nothing.
Yes, Kriya.
You don't need much to strengthen. Then we'll stand on this side.
It's G prime. The audience asked what's the name of the product.
Can I tell them?
On my side of you, I don't have a product. Yes, of course, Tom.
It's Restylane.
It's Restylane.
So now again, I do the assessment of the under eye hollowness. Looking at the camera, I'm not looking at the patient, because I want to feel where it is. And it's there. So I insert my needle and place my finger on the hollowness. I feel the needle tip underneath my finger.
Tom, we can see, it's not clear, it's your hand. So you're deep
No,
to
but
the
nobody
bone?
can. Nobody can see. Nobody can see
Okay,
because it's
yes,
hidden.
that's it. Thank you.
And the fact that nobody can see makes it evident, clear that you must look with your fingertips. Because I can feel the needle underneath my fingertips. So I'm sure that I'm not in an artery because I wouldn't be able to move it about. Since I cannot see the needle tip, I have to watch my plunger. That tells me I put in 0.1. At the same time I can feel with my index finger here, I can feel the gel coming. And I feel the little hollowness repair. And you see reduction of that depth. I'm going to do the same trick here. Here you feel fat, there is orbital rim, there's nothing in between. Let's go in between there. Look it up. So it's constant monitoring of the needle tip. And putting 0.05. Get that. Then the last
So you're
injection.
leaving the product with a bolus technique?
Yes.
You're stable, yes?
Yeah, this is a bolus. You feel a hole, you fill it with a bolus, and you might massage it into something that resembles a UFO even, but that's about it. Then this is McGregor's patch, what I call the golden point, is just underneath, straight for the zygoma. Make sure you are in loose connective tissue. And put in 0.2. So those are the three areas of volume deficiency which I think are important to address. And can you sit up straight? So you see a reduction of this shape, a reduction of that shape. And we'll be doing the other half in the other room where we switch to Palma for his model. Thank you so much.
Okay, thank you, Tom. Is any question from the audience?
Okay.
Tom, I have a question. So could you please tell us the total amount per site that you are going to use with the Restylane?
I've been using 0.3 now. So
okay.
These little lines have been bothering her, so off camera I'm going to treat those two. The marionette folds. I'm going to do the classic fern pattern technique on those. But that's another subject, going to do that off camera. But Insta Live. You can take pictures of her. I checked with her. She's okay with Instagram. We're Instagram Live now on my account. And we keep on running Instagram Live as we go to the other room and finish the other side of the face. Thank you.
Thank you, Tom. Thank you very much. Excellent. Thank you.
Okay, guys.
Good morning, Tatiana.
Good
How are you?
Good
morning, Tatiana.
I'm fine. Hope you're well as well.
Yeah.
So now.
Okay,
Okay.
you can start. Yeah.
Okay. Thanks. So now.
Okay, so where am I taking this now then? Follow.
I'm starting with forehead and then
Where?
Thank you.
Am I put it? I'm sorry. Sorry.
Yeah,
No.
are you good?
Yes, of course.
I will clean you up first. Because it's a mess on that side, of course.
No, you need
This
some.
one?
No, it is soap. Just a second.
I will find.
Oh, we'll find it in there.
Let's see now.
I'm not photogenic.
It's rough.
Your hand is, you have such a light hand. Because I don't feel anything.
Good, good.
And
Well,
without
numbing cream
anes-
helps a lot.
Well, without anesthesia, it's the same. I can manage.
It's okay. Get this. Get you fix your new needle. Go on this side. Close. What's the scar here?
I have here like a mold.
Okay.
They remove me.
Okay. Well, let's fix that. Well, the light is better on this side. Cool. For the inside life, this side is even better because you can get like really close. Cool. See the change?
Definitely.
And how long can I expect the results it will last?
Up to a year.
Oh, great.
But since the skin is very thin, I always advise to do it again a second time after 3 months. Because the Restylane which is in the skin will make the skin react with producing more collagen. And the extra collagen is what you actually want,
Yes.
because that's rebuilding the skin. The extra collagen is far more interesting than the gel itself, the filler. We don't care about the filler, you know. The skin is to be remodeled and restored. Go to that side for the subdermal volume. You can say it.
Yeah.
You might like my parrot on my shoulder. So feeling the depth and choosing some point of entry. So I feel the needle tip. I can move around freely. So don't worry about any dangerous structures. Putting in powders 0.05, 0.1. You see a flattening here. Oh, we can do a little bit more here. So not responding to what you see, but responding to what you feel. That's actually the difference in what I teach you as opposed to what you might have seen before. You can feel it in yourself. There's a lack of fat here. You can move about 0.05 here. Then nasal jugal groove, McGregor's patch, sarcoma, zygomaticotaneous ligament just underneath. This is golden point. That's it. See, strength, volume, correction. And something left. So let's do some fern. You can see an immediate shortening of that linear dermal weakness. Switch to this line. Stay in the middermis to get the best strengthening. Then I go from the other side. You can stay there with the camera. Do the same creases, but now the opposite direction. In between my old injection points to get the maximum benefit of the fern pattern technique. I see nice blanching of the skin because the needle pushes on the small arteries in the dermis. So it's not blanching by the material, it's blanching of the needle. You can see that in front of where the insertion point is. Same trick here. You see, you did see that I slid through the dermis here. That's where I don't want to be, so I reinserted more superficial. And this is like an embroidery. It's very delicate. To be efficient, to stay in the dermis, to strengthen without volumizing, because you don't need volume at this point. Then I go back to that side for the other half fern. Try to see if I can find my old injection points and go in between those. There you go, one syringe. Are you okay?
Of course. I enjoy it. I'm in total zen.
Good, Oh, we're done. And let me get you a mirror. You can interview her in the
So there's no lumps, no bumps,
Ah,
and no pain.
no.
But small.
Very smooth.
Ne treba joj ogledalo, mi smo njezino ogledalo.
Wonderful.
You like it?
Yes, of course. And the most important thing that is that you didn't change anything.
No.
You just
It's your face.
yes, you just strengthened my skin, and that is actually what I ever want. Not changes. Because I don't want to look like everybody.
Somebody else.
Yes. Thank you.
Bye-bye.
Thank you. I'll hug you.
Yeah, sure.
Good. Thank you.
Thank you.
I think you need to hug me.
Yes, of course.
And me, of course.
Bye bye.
Me, of course.
Hug me first.